Over the years, elderly abuse has been one of the most discussed contemporary issues with pressure groups as well as other concerned agencies and individuals demanding a quick and sufficient solution to this problem. In most cases, the older adults are vulnerable to certain actions that surround them. To have proper care, they opt to go into nursing care where they can get all around attention from specialists. However, while in these facilities, they encounter challenges and forms of abuse from different quarters. Regarding the action in nursing homes, this research seeks to explain the types of elderly abuse, which includes sexual, physical, financial, neglect, psychological, and resident-to-resident abuse. Additionally, this research analyzes causes of elderly abuse, effects, as well as proposes solutions that can address this long-standing issue. Moreover, it reviews the different literature regarding elderly abuse to tackle the problem in nursing homes effectively. Since there exist many factors that cause elderly abuse, the paper proposes multiple preventative measures that, if put into practice, can collectively ensure that nursing homes residents enjoy their stay in the facilities. There are millions of elderly adults living in the U.S. today. As the number of elders continue to rise, many has been placed in nursing homes and other facilities. Consequently, the number of nursing home residences in most countries is undoubtedly bound to increase. As expected, the elders visiting these premises, as well as their relatives and friends, always have high expectations that nursing homes will take good care of the aged people. Whereas many of the nursing home residences enjoy proper caring in these facilities, there is almost an equal number of elders that end up victims of abuse. There are many nursing homes in the United States where elderly people are in constant abuse. However, some cases are hard to detect since they are never reported. According to the World Health Organization, approximately 40% of the nursing home patients experience abuse during their stay in these facilities. In fact, the situation becomes even more severe since at least 90% of the residents have reported witnessing at least one of their colleagues abused by caregivers. In the United States, therefore, even though the issue has remained well hidden from the public, everyone in their respective capacity needs to stand together to find a solution to this problem. Elderly abuse in the nursing home falls into 6 categories, which include physical abuse, sexual abuse, psychological mishandling, abandonment, financial exploitation, and resident-to-resident abuse. The first type entails any event or condition that causes physical harm. Apparently, this abuse may be due to neglect, which involves lack of physical care and overuse of restraints of intentional measures, such as pinching or hitting. On the other hand, sexual abuse refers to the unwanted sexual exploitation of attention directed towards these elderly people in the nursing homes. In fact, this type of abuse also entails any sexual attention given in an elderly who has no capacity to express their wishes, or in cases where their caregivers cognitively comprise the age sexuality. Notably, sexual abuse is relatively more prevalent in patients with dementia. Financial exploitation usually occurs when a nursing home takes advantage of patients' financial matters, steals, or compromises the facility's residents' financial status. Apparently, this exploitation could include theft from bank accounts, direct theft, or even applying for credit using the patient's name. In fact, since most of the elderly usually lose their ability to make sound judgment, it is easy for the caregivers to exploit them financially. On the other hand, Psychological abuse, although not easily to identify, includes actions such as criticizing, yelling, or humiliating the elderly. According to Baker, patients who experience psychological abuse are likely to exhibit a behavioral change in a negative manner. Therefore, whereas psychological abuse is the most difficult type to detect, it has the most adverse effects relatively to the nursing home residences. The other type of elderly abuse while in a nursing home is neglect, which in most cases unintentional and most results from inadequate staffing. On this note, neglect takes place when the caregivers fail to take care of residents' needs such as clothing, water, food, and personal hygiene. Apparently, neglect contributes to many medical complications, including skin infections, bed sores, dehydration, and malnutrition, amongst others. The last one is resident-to-resident abuse, which occurs when one of the patients exploits another resident. According to Browski and Hall, these actions may arise in the form of physical, psychological, or sexual harassment. In most cases, the energetic and abled colleagues in the facilities mishandle the less fortunate. Clearly, elderly abuse is prevalent in nursing homes, and there is a good need for an urgent solution to this underlying problem. Apparently, the leading causes of elderly abuse include lack of sufficient staff in nursing homes, lack of adequate resources, unlicensed facilities, and lack of strong laws and policies that protect them against abuse. Therefore, through addressing these causing factors, it is possible to minimize or completely prevent cases of elderly mishandling significantly. However, to achieve this status, it is equally important that the government and other relevant agencies support the nursing homes both financially and through establishing laws and policies that will ensure that the elderly are well protected against abuse while in these nursing homes. It is essential to understand the various forms of elderly abuse in nursing homes as it aids in the enactment of policies that will help to curb the practice. The elderly population in nursing homes is predicted to increase in the future. Therefore, it is important to ensure that they are not abused. Understanding the factors promoting such abuse helps in educating and training staff on the importance of proper and quality patient care. In conclusion, it can be noted that the population of elderly in America has been the increase in the last few years and that the specific trend is expected to continue in the coming years. On the other hand, the elderly has played a major role in development of America as well as the major achievements of this country. In that view, it is paramount that America ensures that measures are in place to facilitate peaceful aging of the elderly who have been vital for the success of this country over the years. For a couple of decades, the number of nursing homes targeted at catering for the elderly have been on the increase. However, the elderly, together with their kin, have found that abuse is rife in various elderly homes, leaving some family with no options apart from withdrawing their elderly from the nursing homes and staying with them at home, even though they do not have the required expertise to look after their elderly. In that view, it is high time that the government, as well as other stakeholders, come together and put in place various measures and at ensuring the elderly who are taken to the nursing homes are not abused and are made to feel comfortable. Nevertheless, even before such measures are taken, it is paramount that those who are attending to the elderly are made aware of the fact that the elderly should be respected and treated in a human manner, as well as have sacrificed a lot for the health and benefit of this country in the past, and for reason they deserve to age with peace.